Pioglitazone Hcl, also known as glitazones, is a diabetes medication used to control high blood sugar in patients with type 2 diabetes. It works by helping your body respond properly to insulin, thus lowering your blood sugar levels. By controlling high blood sugar, Pioglitazone Hcl helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function issues. It may also reduce the risk of heart attack or stroke. This medication can be used alone or in combination with other diabetes medications such as metformin or glyburide. It is important to talk to your doctor about the risks and benefits of taking Pioglitazone Hcl. As for the dosage, it is usually taken once daily with or without food. It is best to take it at the same time every day to help you remember. And it is important to follow your doctor's instructions carefully for the best results. Before you start taking Pioglitazone, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. The dosage is based on your medical condition and other medications you may be taking. Remember to inform your doctor about all the products you use. Take this medication regularly at the same time each day to get the most benefit from it. It may take 2 to 3 months before the full benefit of this drug takes effect. If your condition does not improve or gets worse, make sure to consult your doctor. If you experience sore throat, muscle pain, weight gain, or tooth problems, it's important to notify your doctor or pharmacist. This medication has been prescribed to you because the benefits outweigh the risk of side effects. It's important to tell your doctor if you experience new or worsening vision problems, bone fracture, reddish-colored urine, urgent need to urinate, pain while urinating, or signs of liver disease such as nausea, vomiting, dark urine, yellowing of eyes or skin, and stomach or abdominal pain. Pioglitazone does not typically cause low blood sugar, but it may occur if this drug is prescribed with other diabetes medications. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It's important to carry glucose tablets or gel to treat low blood sugar, and to eat a quick source of sugar if needed. If you experience symptoms of high blood sugar, such as increased thirst or urination, it's important to notify your doctor right away. If you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, dizziness, or trouble breathing, seek medical help immediately. It's important to remember that this is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. If you notice any symptoms of heart failure such as shortness of breath, swelling ankles/feet, unusual tiredness, or sudden weight gain, it's important to inform your doctor immediately. It's also worth noting that this medication is not recommended for people with certain types of heart failure, so be sure to discuss any heart conditions with your doctor before starting Pioglitazone Hcl. As for the daily dosage and timing, your doctor will advise you on the best way to take this medication based on your individual needs. Before taking Pioglitazone, it's important to let your doctor know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions. It's also important to inform your doctor about your medical history, especially if you have heart disease, liver disease, fluid in your lungs, swelling, anemia, a certain eye problem, or bladder cancer. You may experience blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar. Avoid driving or using machinery until you are sure you can do so safely. Limit alcohol while taking this medication as it can increase the risk of low blood sugar. Also, it may be harder to control your blood sugar when your body is stressed, so consult your doctor if you experience increased stress. Pioglitazone may increase the risk of bone fracture in women and can also cause changes in the menstrual cycle. It's important to use reliable birth control while using this medication. If you are pregnant, discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding while using this medication. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor. If you are taking beta-blocker medications, they may prevent the fast or pounding heartbeat that usually occurs when your blood sugar drops too low. However, other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are not affected by these drugs. It's important to be aware that many drugs can affect your blood sugar levels, making it more difficult to control. Before making any changes to your medication, talk to your doctor or pharmacist about how it may affect your blood sugar. Make sure to regularly check your blood sugar and share the results with your doctor. If you experience symptoms of high or low blood sugar, notify your doctor immediately. Your doctor may need to adjust your diabetes medication, exercise routine, or diet. If you suspect an overdose with serious symptoms like passing out or trouble breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can contact your local poison control center at 1-800-222-1222, while residents of Canada can call a provincial poison control center. It's important to attend a diabetes education program to learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. Make sure to learn the symptoms of high and low blood sugar and how to treat low blood sugar. Check your blood sugar regularly as directed and share the results with your doctor. In addition to taking this medication, lifestyle changes that help promote healthy bones include increasing weight-bearing exercise, eating well-balanced meals containing adequate calcium and vitamin D, stopping smoking, and limiting alcohol. Consult your doctor to see if you need to take calcium/vitamin D supplements and discuss lifestyle changes that might benefit you. It's also important to have regular lab and/or medical tests, such as liver function, blood glucose, hemoglobin A1c, complete blood counts, and eye exams, while you are taking this medication. Be sure to keep all medical and lab appointments. If you forget to take a dose of Pioglitazone Hcl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing Pioglitazone Hcl, it's important to keep it at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and always keep it out of reach of children and pets. Additionally, it's important to properly dispose of this medication when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.